man present to the emergency department with a swelling over the left elbow after a fall on outstretched hand. On examination, there is tenderness over the proximal part of the forearm. That means the proximal part of the forearm, there is the two bone. One is the radius, another one is the ulna, and severely restricted supination and pronation movement. What is the most likely injury? As there is tenderness over the proximal part of the forearm, that means below the elbow joint. So there is two important bones. One is the radius, another one is the ulna. So the fracture or injury to occurs either radius or ulna. What may be the options? The options are fracture of the olecranon, fracture of the radial head, Galeazzi fracture, fracture of the shaft of the radius and ulna, and fracture of the coronoid process. So what may be the answering option? So first of all, let's see, this is this part, it is the radial head, and this area is the ulnar part, ulnar olecranon. This here, the ulnar olecranon, it is up to this. So this part is the radius and this part is the ulna. And in this picture here we can see this is the slight fracture in the radial head, and here we can see the management of this fracture. That means there is a screw giving in this area. And let's see the radial head fracture. The radial head fracture is very common in young adult. It usually caused by fall on outstretched hand. So this point is important. In the upper limb, in outstretched hand falling, there are different type of the injuries, such as the Colles fracture, Smith fracture, also the Galeazzi-Montagia fracture and Barton fracture. They are due to outstretched hand. But we have to see the other examination also. And there is the marked local swelling over the head of the radius. There is impaired movement at the elbow. That means the loss of the movement at the elbow joint. And what occurs? The sharp pain at the lateral side of the elbow, and there is extreme rotation. That means the pronation and supination lost. So when there is the pronation and supination lost in this condition, radial head fracture. So this is the key point. Key point is the pronation lost, supination lost. It is mainly done by the which bones? It is mainly done by the radial bone. So there is the fracture of the radial head. So as the supination and pronation movement loss and proximal part of the forearm, and this point, this is the supination and pronation. It is the diagnostic point for the fracture of the radial head. Other option here, such as the fracture of the olecranon. The olecranon is a part of the ulna, and the ulnar movement usually not the supination and pronation. So it is not correct. And the Galeazzi fracture, it occurs the fracture of the radius with a joint involved, which is the distal radioulnar joint disruption. But here there is not such type of the injury. Fracture of the shaft of the radius and ulna, but here this is the proximal part of the forearm, not the medial part of the forearm. And the fracture of the coronoid process, also not true, because the coronoid process is also a part of the ulnar bone. So as the supination and pronation movement restricted or hampered in this condition, the answer will go for the fracture radial head.